here is our host, Tian Wei.
Hello and welcome to World Insight on CGTN from Beijing. I'm Tian Wei. We start today's program with the latest on the COVID-19 pandemic. Worldwide, confirmed cases, take a look at this, surpassed 2 million. The U.S. has reported more than 29,000 new cases and 4,000 deaths over the past 24 hours. Total cases there top 639,000. That's about 1/3 of the global total. U.S. President Donald Trump has drawn worldwide condemnation after he announced he was halting funding for the World Health Organization. That's only making things worse in the global pandemic. On that, earlier I talked to Jeffrey Sachs, a professor of economics and director of the Center for Sustainable Development from Columbia University, for his views on the latest decision made by the U.S. president. And now I'm joined by Jeffrey Sachs, professor of economics and director of the Center for Sustainable Development at Columbia University. Professor Sachs, it was a pleasure seeing you.
Thank you very much. Good to be with you.
Professor Sachs, your direct comments about the latest news suggesting the U.S. would suspend funding for WHO, pending the U.S. review of WHO's performance.
Well, I think it's disgraceful. WHO is a crucial institution at the very moment of this world epidemic, so it needs all the help that it can get. Of course, what Trump is trying to do is to shift the blame for the United States' failure to control the epidemic to WHO or to China or to anyone that he can do so, because he does not think properly. He does not think honestly. He is just desperately trying to shift responsibility for the terrible epidemic that is raging in the United States out of control.
What are some of the sources that the White House would get in terms of evaluating a virus or a public health related issue, Professor?
Well, there are many experts in the United States. Our country is filled with scientific expertise. It just depends on whether the government listens to expertise or not. And right now, for many, many weeks, Trump has said he's going to decide these things. And he says ridiculous things, I'm afraid. Very unfortunate, because we have a lot of expertise in the United States, in our schools of public health, in our government institutions. There are many fine scientists. But it requires that the government apparatus give authority to and listen to the expertise. And if a politician like Trump, who doesn't understand very much of anything, decides to make decisions on his own or to make statements that are absolutely without a scientific basis, the whole country gets in trouble. This is a matter of leadership, but the right kind of leadership empowers expertise, honors evidence, operates in a transparent manner, and this is the way to get a crisis like this under control.
Meanwhile, we understand there has been interactions, close interactions, in fact, over the past years between the China CDC and the U.S. CDC. Even on the 3rd of January, there were reportedly conversation going on between the directors of the two CDCs after China made it to the world known December 31st by informing the WHO of the virus. So various sources, do you think the White House has been using it well?
There were many reports by the U.S. intelligence agency, which was monitoring this risk. There were memos inside the White House. So this wasn't a mystery. And also, when one looks at precautions, when China locked down all of China, this was an incredible step. So anybody watching this would understand that this is extraordinarily dangerous. But unfortunately, the U.S. government did not act properly. We lost several weeks. By the time there was some kind of focus on it, the epidemic was really raging with tens of thousands of cases. You know, at a certain point, it becomes so difficult to control. So the U.S. has basically gone into a kind of national lockdown now. It's really very unfortunate. We will get this under control despite the failures of the White House. I think this lockdown will reduce the number of cases, but what's important in an epidemic is that after the number of cases come down, then there has to be very, very serious public health measures to trace every potential new outbreak. This is what China has to do now, because every day there are some dozens of people returning from abroad infected. And if they are not paid attention to, then the virus is going to spread again. So it requires very organized work, systematic work.
Yeah, Professor, you've been calling on the coordinated efforts of the federal government in the U.S. Have a general approach to COVID-19 now and also in the future, even talking about the exit strategy. That's one area, but the other area is what is the relationship, as we have been hearing, the argument between the White House and also, for example, the city of New York, the state of New York, about, federal and the local level authorities regarding public health issues.
What I make of it is that there's very little systematic and scientific discussion taking place in politics between the federal government and the states. So the state governments have no confidence in the statements that are being made in Washington. And they are saying, we're not listening to the president when he simply makes statements that are not supported by evidence, not supported by science, not supported by clear explanations and judgments. So the governors are saying they have responsibility for their states, and they don't trust the president of the United States. As I say, it's very sad, because the United States is a country filled with wonderful scientists. We have thousands of universities. We have tremendous scientific capacity. But if the politicians ignore it, don't use it, then it does not work when the crisis comes.
Having said that, though, let me move on to another issue. You've been accusing this administration in the U.S. of not doing right this time in COVID-19 crisis. But, if you look at some of the other countries, some in Europe also, people also argue whether there has been appropriate measures being taken at the right time or timely measures being taken. What's your take?
In general, no. Both the U.S. and the European countries did not do well. One of the reasons, I think, is that in Asia, the memory of SARS from 2003 remains very strong. SARS was very frightening, and it led to a lot of changes in public policy and in the public health systems all through East Asia. When this epidemic broke out, the idea that this was like SARS, even more dangerous because it spreads in a nastier way, it doesn't give evidence beforehand when it's spreading like SARS did, so it's harder to control. It made the countries of East Asia go on high alert, especially after January 23rd, when China began really cracking down. I think all through East Asia, the dangers were very clear. But in the US and in Europe, this seemed far away. It didn't seem like a direct threat. And our public health systems are not on alert the way they should be. I blame Trump because he was told repeatedly how dangerous this was, and he ignored it. And because even when the dangers became clear, he has been incapable of listening properly to people who know much better than he does.
Amid the global pandemic, nationalist sentiments in many countries are rising. Public health issues are seen and even amplified through geopolitical and electoral lenses. Jeffrey Sachs, one of the many voices in the world who are calling for cooperation, give us clues how we can step up global efforts in combating the pandemic and its economic repercussions. Let's listen in. We've been seeing nationalistic voices in various countries around the world, all kinds of economies that have been becoming ever louder. Do you think voices like that of yours, Professor Sachs, that are calling for cooperation, is going to prevail this time? Are you very optimistic about that?
I think that cooperation is our only way forward, certainly in this epidemic, but also we face so many crises that are very serious. We face the climate crisis, extremely serious, and many others as well. There was going to be the meeting in Kunming on biodiversity. Well, it's been canceled now, or postponed, I should say, until next year. But that's a very serious crisis, too, if we care about our health and our food supplies. Yes. And the functioning of the natural environment. That requires cooperation as well. But, you know, in geopolitics, one of the games of the United States is to create divisions and to say China's on one side, we're on another side, you have to pick sides and so forth. This is an old playbook. It's an extremely dangerous playbook. We don't want the world divided. It's going to serve nobody to have a divided world. And so we should understand, especially at this moment of crisis, to be mutually accountable and responsible. And that's why this announcement about halting payments to WHO is so disgusting, is really what it is. Because this is, of course, absolutely the worst conceivable moment to be even thinking in such a direction. Quality of government has really declined very badly right now. And we need global cooperation. Yes. And Trump, of course, has also been an enemy of global cooperation. He's the man of trade wars, technology wars, making division, taking the United States out of international treaties, now stopping payments for WHO at the height of a global crisis unprecedented in our lifetimes. So this is a shocking kind of action, but I hope that other countries will rise to the occasion. You know, one basic idea that I really would like to emphasize is that it is not only China that has done a good job of controlling the epidemic, but to many neighbors as well. Korea, Japan, Singapore, and other countries, Vietnam also. And I hope that the countries of East Asia could really step up cooperation right now to help the rest of the world. Because we're still in an extraordinarily dangerous moment for the world, not only the U.S. and Europe, as we've been talking about, but Africa and South Asia.
Absolutely.
And Latin America, because the fate of the world is still at stake right now. So I hope that countries would step forward and say, we support the World Health Organization. We ensure that it has an adequate budget to do its crucial job. And I would hope that even when there are sometimes political difficulties as well, that Japan and China and Korea and other countries could work very closely together right now to say to the whole world, we're ready to help. We can supply test kits, we can supply equipment, we can supply advice, we can supply apps on the smartphones, we can supply the kind of techniques that we have used successfully in East Asia to bring this epidemic under control and help Africa India, South America, and other parts of the world to do the same.
Yeah. Do you think that after the U.S. and Europe coming out of this crisis, I mean, at least this wave of coronavirus, we don't know how many waves will come before a vaccine could be available. But having said that, if they come out of it, would they be able to help, or there's likely to be an increasing reluctance of looking outward, but rather only looking inward?
Well, I'm afraid that in the United States right now, we're in the most aggressive anti-multilateral stance of modern times. Now it stands mostly in opposition to the international system. It attacks the United Nations, it attacks the World Trade Organization, it attacks the Paris Climate Agreement, and this is Trump's politics. Trump, remember, is America first, America first, America first. It's a very dangerous and naive approach to the world. I've written a book recently about it, about this kind of American exceptionalism, which says America doesn't have to play by the rules. I'm very much concerned and don't believe it's going to change soon.
Professor Sachs, what about global supply chains? Now, the national institution you just mentioned needs urgent support, coordinated efforts. International global supply chains, on the other hand, could be the basis upon which countries are working together because they share common interests. So what's going to happen over there from your observation so far?
Well, it will require a lot of effort to make sure that global food trade continues as normal. You know, many places that are extremely important for the global food supply, such as South America, have a major epidemic right now. Brazil is facing a major epidemic. Argentina is facing a major epidemic. So where the food comes from, or the feed grain comes from, is not in a sure situation right now. I've spoken to government officials in South America who are very concerned about the health of the agricultural workers and the ability to bring in the harvest and make sure that it enters the global supply chains.
Yeah.
Now, on the other side, every day governments are calling me and asking for help to get test kits and to get equipment. And so we have a mutual dependence in this world. China depends on the food supply chains globally, and the world depends on China's production as well. And this is because we have an international trading system, and thank goodness we do. Food and Agriculture Organization, FAO, in Rome.
Yes.
I know that they're working on this and very concerned about it, and it is another area where I think China can give support and other major countries can give support to make sure that the food supply chain, the medicine supply chain, the medical equipment supply chains, that they all continue to function in the midst of this crisis.
Jeffrey Sachs, Professor of Economics and Director of the Center for Sustainable Development with Columbia University. Professor, thank you so much for joining us. Thank you also for your straightforwardness in your comments and also for being a globalist all the time.